comes to women's health, there's one condition that's often spoken about, but still so misunderstood, and that is endometriosis. Now, today, we're unpacking the facts and the options with two experts. We have Laura Johnston, CEO of PHYTOCEUTICS, and Dr. Kate Chambers, an obstetrician and gynecologist at the Women's Health Group at Cape Town Clinic. Ladies, welcome, and thank you so much for being here. So, Doc, maybe I could come to you first and speak about what endometriosis is exactly, because there might be some myths that you want to bust at the same time.
Endometriosis is essentially a chronic condition, which can be quite debilitating, but it's quite difficult to diagnose as well. But it's essentially when you've got the lining of the uterus is called your endometrium. And when you've got tissue that is similar to that outside of the uterus in the pelvis. You've got little deposits of tissue throughout the pelvis, can sit on the bladder, in the ovaries, on the other pelvic organs, and it responds to your natural cycle, your hormonal cycle, so as does the endometrium. So when you have your period, the tissue inside the abdomen, you have a little bit of bleeding, causes pain, inflammation, which ultimately can cause some quite debilitating symptoms.
How does one even diagnose endometriosis?
So it can be quite difficult.
Yeah.
Ultimately, the only way you can truly diagnose endometriosis is with surgery and by taking a biopsy of the tissue, sending that to the lab and confirming it with histology. But you can't take everybody to theatre.
Right.
So we base most of the diagnoses based on symptoms and history. The symptoms that we look out for, mostly it's very heavy, painful periods, but not only pain during your period.
Yeah.
So when you're ovulating, you can get pain when you have intercourse, pain when you're passing urine, when you pass stool. Some people present with gut symptoms, present with bloating, just like IBS type symptoms. So it is very difficult, but mostly the diagnosis is made on history.
So would this symptoms start showing once you hit puberty, or does it happen sort of later in life?
When you are young and you hit puberty, your body's still getting used to all your hormones and all of those sorts of things. So you don't really know what is normal for you at that stage and what is a diagnosis. So I wouldn't really diagnose a young teenager with endometriosis. I'd rather, treat it other ways and then see later on how they progress.
What are some of the treatment options one could go for?
There's different things that you can look at. So you can break it down into your non-pharmacological, your pharmacological, and your surgical. So your non-pharmacological would be anything that helps with managing stress, because we know stress reduces your pain threshold. So exercise, we know, helps with pain, especially over your period. Anything that you can do to help with anxiety and stress, so whatever works for you. So meditation, yoga, those sorts of things. Also avoiding an inflammatory diet. So high processed foods, sugars, which we know increase inflammation in the body, which worsens your pain. Then when you look at your pharmacological, it can further be broken down into your hormonal and your non-hormonal. So your non-hormonal would be your symptomatic treatment, so your painkillers, your analgesia, your anti-inflammatories, which are great for symptom management, but are not really a long-term because they have their own side effects. So we look mainly at your hormonal treatment. Because what you're wanting to do is you're wanting to reduce the amount of time that you bleed. By doing that, you're reducing the inflammation and pain inside the abdomen. So you can use combined oral contraceptives, which you can either skip your period so that you don't have a bleed. You can use progesterone-only contraceptions, and you've also got your progesterone-only intrauterine devices, which work really, really well to prevent a period and thus reduce the pain. And then you've got your surgical management. Surgery is for patients who've been on medication, who are not responding to medication, who have severe pain, or who have very advanced disease.
So much info, I'm absorbing it all. This is fantastic. Laura, I want to come to you and just ask about maybe the supplement side of things. I know that there definitely are solutions in that regard. Maybe you could take us through some of them.
Yeah, so I think the benefit of supplements is that you can take them over an extended period of time, unlike a lot of your pharma products. So curcumin is a very powerful anti-inflammatory, and that can be very beneficial for endometriosis. So biocurcumin uses BCM95, which is a very well-studied curcumin extract, very bioavailable. Magnesium for muscle cramps, also massively beneficial, also for stress. And then there are certain probiotics that work on the gut-brain axis to help with stress management. You've got adaptogens like ashwagandha. So, looking at ways to help with inflammation and stress in a natural way that you can sustain over a longer period of time.
When you stop and want to fall pregnant, I mean, how does that whole process sort of work?
Yeah, so it is tricky because once you stop the treatment, your symptoms are going to come back. So what we do say is that when you are thinking about fertility, even if it's in the future, we want you to be on some sort of hormonal contraception while you're waiting until you're ready to fall pregnant, because you want to prevent the progression of the disease. So by preventing the progression of the disease, you're helping your tubes stay normal, your pelvis stay normal, you're reducing inflammation and scar tissue, because those, if they become really bad, can cause infertility.
Sure.
So what we suggest is that when you are ready, we want you to be really ready, and then when you stop your hormones, we want you to get pregnant as soon as possible. And it's the same after surgery. We often do surgery for infertility, and once you've had the surgery, we recommend you get pregnant as soon as possible, because it forms a part of treatment because you're not having your period.
For that 9-month period.
Yeah, exactly.
Oh, that's incredible. Are you at higher risk of having difficulty falling pregnant if you have endometriosis?
Definitely not in the early stages, but if you've got, so we grade it, grade 1, 2, 3, and 4. If you've got stage 3 or grade 3 and 4, it can be quite difficult because you've got a lot of scar tissue in your abdomen. It can cause distortion of your tubes, your ovaries get affected. So it's definitely something that we see quite often.
Sure. And if you do fall into this category, I mean, help is clearly on the way and on our couch. So don't even feel a little bit grim, okay? You'll be okay. So now, whether it's medical support, lifestyle shifts, or even natural supplements, there are always ways to manage endometriosis and also take back control of your health. This is what I want for you. So go ahead and start by visiting PHYTOCEUTICS.com to get your journey to begin.
Optimize your gut health with PHYTOCEUTICS range of pre, pro, and postbiotics. Use code Expresso for 15% off at PHYTOCEUTICS.com.